we've made the issue of child poverty our central theme for all the work across children's centres, Sure Start's Children's Fund. It's now part of the Sustainable Community Strategy for Cornwall and an indicator, a designated indicator within the local area agreement.
What we've done in children's centres in our district is I do training sessions with all the local children's centres on what we have to offer. So we give a generic view of Job Centre Plus and the work that we're doing with the families.
Family intervention projects, where there's a nominated health professional in 53 different areas, trying to help signpost and direct and refer to some of the most disadvantaged families. I also cover domestic abuse, which is one of the key 5 areas for disadvantaged families.
I think a key example I would give is some of the work that Shelter's trying to do through the advice line they've set up for children's centres staff to actually use. When they're working with families that have got housing and homelessness issues, they've got an advice line they could phone up and get further advice of where they can either signpost to or to get referrals to get the support that those families need in helping them with their housing issues.
We have some advisors based in some children or doing interviews from some children's centres, and the results that they're getting is really good. We find that if the advisors see the clients in children's centres, the participation rate on the Lone Parent Programme is far higher than if they see them in job centres.
We had a new deal for Lone Parents advisor who comes into the centre every week to do in-work benefit calculations to support the lone parents that are on her caseload that are also parent users of the Children's Centre.
In Nottingham, the mental health services have teamed up with Job Centre Plus, and they're running special courses for parents with mental health problems, learning disabilities, and that's in the Children's Centre. And when they put it into the Children's Centre, they had a 70% increase in people that took it up.
Helping people to build their employability skills, so that not just in terms of job searching skills, but things like basic skills screening, confidence building sessions, childcare as a profession. So there's a whole range of different training that we do as well.
We've got conferences that have been going on where we've been working with DWP, trying to increase the strategic engagement from Government Office. So we've had meetings with their regional director. They've given and done workshops on the child poverty agenda. I've done presentations to the childcare partnership managers, which they're based within DWP and are responsible for seeing that members of staff there are aware of childcare and childcare needs.
Yeah, we have policy statements from agencies that are involved in the agenda. We have research reports. But, you know, in terms of frontline staff, they really practically haven't got the time or the inclination to actually go away and study those kinds of reports.
The frontline staff need to know that it's a priority within their area, so they're not working in isolation on it. And then they need to be given a practical toolkit that's useful for them to be able to use within their immediate children's centre area.
So it's actually just about giving them a simple framework, a simple tool around how they articulate poverty.
Which is through the likes of fact sheets, explaining about the agenda in terms of the strategy position of government.
That includes an understanding of how to recognise, identify things like mental health problems with parents or domestic abuse, and signpost and refer to the appropriate areas.
I think within job centres we need to make sure they have a continued awareness of the whole child poverty agenda, that they know how they fit into it and how they can influence it. I think it's very important for them to see it as an integral part of their role and not just something that happens around about them.
So that they know they're working within a bigger picture. I think that's the key thing for them.
I think in doing that, then they will have a greater understanding of the bigger strategic agenda around eliminating child poverty.
In the West Kent Primary Care Trust, they've linked up with the Children's Centre there, and they have what they call doulas, which are volunteer moms who go in and help either new moms or very vulnerable moms. Many of them have multiple children under the age of 5, and they provide support through the pregnancy and postpartum 6 to 8 weeks afterwards.
We received a DVD from Blackpool Local Authority that talks about their integrated service and how they're developing an integrated service around the child, talking about the common assessment framework, putting a lead professional in charge of that, and they coordinate all the other services and make sure that that family are guided through.
We think the approach is really successful because it's integrated, and I think that's the key driver, is that meaningful partnership is about working in a deliberately planned way with Job Centre Plus effectively.